This is Dr. Walt with Insights for MCTV. Using your body as a weather instrument means knowing what it's made up of. For forecasting purposes, your body can be considered a large bag of water with an air bubble in the middle of it. Besides your lungs, various other bubbles with much smaller dimensions may be in there with you. They can form in the fluid of your knees, the corners of your intestines, or in the scar tissue from an old wound. Even a poorly placed filling in your teeth can have tiny air bubbles trapped behind it. Why this matters is due to the weight of the atmosphere around you. The air pressure on your body is about 15 pounds per square inch. That means the total area of your body supports thousands of pounds of pressure. When a storm comes by and lowers the pressure around you, the normal squeezing is relieved and your body expands slightly. The trouble is, it expands unevenly. Any internal bubbles you carry will tend to expand more than solid flesh. These slow motions may or may not nudge their way into your consciousness, depending on how large the bubbles are and where they're placed. If the bubbles are placed near nerve endings, for example, you'll definitely feel them. If they're old bubbles, like in scar tissue, you may be so used to the feeling that they're hardly noticed. However, this is the basis of someone having a trick knee and forecasting a storm with it. Of course, we're not the only critters affected by atmospheric pressure. The sensitive ear canals of some birds feel the pressure change so that they fly closer to the ground to relieve the pain. Similarly, that rare person with many scars and their associated bubbles would find relief in a mine shaft or at the bottom of the Grand Canyon. So remember, if you get headaches during a storm, you may have air bubbles in your head. However, like the weather forecast itself, that's just a matter of opinion. This is Dr. Walt with Insights for MCTV.